Hi friends, this is Dr. Mohammed Usman. Now let's talk about Bacopa Monnieri. There are 7 emerging benefits of Bacopa. Bacopa, also called as brahmi, water hyssop, thyme-leaved gratiola and herb of grace, is a staple plant in traditional Ayurvedic medicine. It grows in wet, tropical environments and its ability to thrive underwater makes it popular for aquarium use. Bacopa has been used by Ayurvedic medical practitioners for centuries for a variety of purposes, including improving memory, reducing anxiety, and treating epilepsy. In fact, research shows that it may boost brain function and alleviate anxiety and stress, among other benefits. A class of powerful compounds called bacosides in Bacopa is believed to be responsible for these benefits. Here are 7 emerging benefits of Bacopa. It contains powerful antioxidants. Antioxidants are substances that help protect against cell damage caused by potentially harmful molecules called free radicals. Research suggests that damage caused by free radicals is linked to many chronic conditions such as heart disease, diabetes, and certain cancers. Bacopa contains powerful compounds that may have antioxidant effects. For example, bacosides, the main active compounds of Bacopa, have been shown to neutralize free radicals and prevent fat molecules from reacting with free radicals. When fat molecules react with free radicals, they undergo a process called lipid peroxidation. Lipid peroxidation is linked to several conditions such as Alzheimer's, Parkinson's, and other neurodegenerative disorders. Bacopa Monnieri may help prevent damage caused by this process. For example, a study showed that treating rats with dementia with Bacopa reduced free radical damage and reversed signs of memory impairment. It may reduce inflammation. Inflammation is your body's natural response to help heal and fight disease. However, chronic low-level inflammation has been linked to many chronic conditions including cancer, diabetes, and heart and kidney disease. In test tube studies, Bacopa appeared to suppress the release of pro-inflammatory cytokines, which are molecules that stimulate an inflammatory immune response. Also in test tube and animal studies, it inhibited enzymes such as cyclooxygenases, caspases, and lipoxygenases, all of which play a key role in inflammation and pain. What's more, in animal studies, Bacopa had anti-inflammatory effects comparable to those of diclofenac and indomethacin, 2 non-steroidal anti-inflammatory drugs commonly used to treat inflammation. Nevertheless, more research is needed to determine whether Bacopa reduces inflammation in humans. It may boost brain function. Research suggests that Bacopa may help enhance brain function. For example, one study in mice showed that supplementing with Bacopa improved their spatial learning and ability to retain information. The same study also found that it increased dendritic length and branching. Dendrites are parts of nerve cells in the brain that are closely linked to learning and memory. Additionally, 12-week study in 46 healthy adults observed that taking 300 milligrams of Bacopa daily significantly improved the speed of processing visual information, learning rate, and memory compared with the placebo treatment. Another 12-week study in 60 older adults found that taking either 300 milligrams or 600 milligrams of Bacopa extract daily improved memory, attention, and the ability to process information compared with the placebo treatment. It may help reduce ADHD symptoms. Attention deficit hyperactivity disorder is a neurodevelopmental disorder that is characterized by symptoms like hyperactivity, impulsivity, and inattentiveness. Interestingly, research has shown that Bacopa may help reduce ADHD symptoms. One study in 31 children aged 6 to 12 years found that taking 225 mg of Bacopa extract daily for 6 months significantly reduced ADHD symptoms such as restlessness, poor self-control, inattention, and impulsivity in 85% of the children. Another study in 120 children with ADHD observed that taking a herb blend that contained 125 mg of Bacopa improved attention, cognition, and impulse control compared with the placebo group. Although these findings are promising, more large-scale studies examining the effects of Bacopa on ADHD are needed before it can be recommended as a treatment. It may prevent anxiety and stress. Bacopa may help prevent anxiety and stress. It's considered as an adaptogenic herb, meaning it increases your body's resistance to stress. Research suggests that Bacopa helps reduce stress and anxiety by elevating your mood and reducing levels of cortisol, a hormone that is closely linked to stress levels. One rodent study showed that Bacopa had anti-anxiety effects comparable to those of lorazepam, which is a benzodiazepine, a prescription medicine used to treat anxiety. However, human studies on Bacopa Monnieri and anxiety show mixed results. For example, two 12-week human studies found that taking 300 milligrams of Bacopa Monnieri daily significantly reduced anxiety and depression scores in adults compared with the placebo treatment. Yet another human study found that treatment with Bacopa had no effects on anxiety. More large-scale human studies are needed to confirm its effects on stress and anxiety. It may help lower blood pressure levels. High blood pressure is a serious health concern as it places strain on your heart and blood vessels. This can weaken your heart and increase your risk of heart disease. Research suggests that Bacopa may help keep blood pressure within a healthy range. In one animal study, Bacopa reduced both systolic and diastolic blood pressure levels. It did this by releasing nitric oxide, which helps dilate blood vessels, resulting in improved blood flow and lowering blood pressure. However, one 12-week study in 54 healthy older adults found that taking 300 milligrams of Bacopa daily had no effect on blood pressure levels. Based on current findings, Bacopa may lower blood pressure in animals with high blood pressure levels. Nevertheless, more human research is required to confirm these effects. It may have anti-cancer properties. Test tube and animal studies have found that Bacopa may have anti-cancer properties. Bacosides, the active class of compounds in Bacopa, have been shown to kill aggressive brain tumor cells and inhibit the growth of breast and colon cancer cells in test tube studies. Additionally, Bacopa induced skin and breast cancer cell death in animal and test tube studies. Research suggests that the high level of antioxidants and compounds like bacosides in Bacopa may be responsible for its cancer fighting properties. Keep in mind that these results are from test tube and animal studies. Until there are more human studies on Bacopa and cancer, it cannot be recommended as a treatment. Bacopa has some side effects. It is generally safe, but it can cause side effects such as digestive symptoms, including nausea, stomach cramps, and diarrhea. Bacopa is not recommended for pregnant women as no studies have assessed the safety of its use during pregnancy. Finally, it may interact with certain medications, including amitriptyline, a medicine used for pain relief. If you are taking any medication, speak to your healthcare provider before taking Bacopa. The typical dosage for Bacopa extract in human studies range from 300 to 450 milligrams per day. However, dosage recommendations can vary widely depending on the product you purchase. If you have questions regarding dosage, speak with a qualified healthcare professional to ensure your safety. The powdered form can be added to hot water to make a soothing tea. It can also be mixed with ghee, a form of clarified butter, and added to warm water to make a herbal drink. Bacopa is an ancient Ayurvedic herbal remedy for many ailments. However, human studies show it may help boost brain function, treat ADHD symptoms, and reduce stress and anxiety. Furthermore, test tube and animal studies have found that it possesses anti-cancer properties and reduces inflammation and blood pressure. Although these potential health benefits are promising, more research on Bacopa is needed to understand its full effects in humans. I hope you like the video. Please like and share our channel, subscribe to our channel. Thank you.